Have you ever noticed changes in how often you're going to the bathroom, especially at night? Or felt a sense of pressure, discomfort, or an unusual delay when trying to urinate, and just brushed it off as nothing? These small, easy-to-nix signs might actually be your body's early way of warning you that something isn't quite right with your prostate. The problem? Most men don't recognize these symptoms for what they really are, or worse, they ignore them altogether, thinking it's just part of getting older. But here's the truth. Waiting too long can turn a manageable issue into a much more serious condition. In today's video, we're shining a light on the early warning signs of prostate issues, signs that far too many men overlook until it's more difficult to treat. Whether it's an enlarged prostate, inflammation, or early stages of prostate cancer, the first symptoms are usually subtle and often mistaken for something harmless. That's why awareness is your first line of defense. We'll explore 3 key things that every man should know. First, we'll break down the most common early signs of prostate problems, from frequent nighttime urination to changes in stream strength, and what they might actually mean. Second, we'll look at the groups of men who are most at risk. Are you over 40? Have a family history of prostate issues? Do you live a mostly sedentary lifestyle or rely heavily on processed foods? These factors could increase your chances of developing prostate conditions. And third, we'll go over simple, research-backed lifestyle changes that can help protect and support your prostate naturally. No extreme donuts, no gimmicks, just practical habits you can start today. Don't wait for symptoms to get worse. Prostate issues may be common, but many of them are preventable or manageable if you act early. So stay tuned, because what you learn today could make all the difference tomorrow. Let's get ahead of it, starting now. Early warning signs to watch for prostate issues often begin silently, with symptoms that seem minor at first. But these early clues can be critical. HSOD can be critical. Recognizing them early can help you avoid serious complications down the line. Here are the most common early warning signs that your prostate may be trying to tell you something's wrong. Frequent urination, especially at night. Are you waking up multiple times during the night just to use the bathroom? This is one of the earliest and most overlooked signs of prostate enlargement, also known as benign prostatic hyperplasia, BPH. As the prostate grows, it can press against the bladder and urethra, making you feel like you have to go, even when your bladder isn't full. Weak or interrupted urine stream, a feeling that your bladder isn't fully empty. After urinating, do you still feel like you need to go again? This constant urge can be frustrating and uncomfortable. It may mean that your prostate is interfering with proper bladder emptying, an issue that can increase the risk of infections or bladder stones over time. Pain or discomfort when urinating or ejaculating. Burning sensations or discomfort during urination or ejaculation could point to inflammation of the prostate, prostatitis. This condition may be caused by infection or irritation and shouldn't be ignored. Blood in urine or semen. While rare, even a small amount of blood in your urine or semen is a serious sign that should be evaluated immediately. It may be caused by an infection, inflammation, or in more serious cases, cancer. Even one of these symptoms can signal that your prostate is enlarged, irritated, or possibly even developing a tumor. The important thing to remember is this: the earlier you catch it, the more treatment options and better outcomes you have. Don't wait. Listen to your body. Early action can make all the difference. 2. Who's most at risk? Prostate problems don't happen at random. While anyone with a prostate can experience issues, certain risk factors significantly increase the chances of developing conditions like benign prostatic hyperplasia, BPH, prostatitis, or even prostate cancer. Listen to your body's most at risk. Prostate cancer, BPH, prostatitis, or even prostate cancer. Let's take a closer look at who is most at risk. Men over 40 age is one of the biggest risk factors. As men age, the prostate naturally begins to enlarge. By the time you reach 50, nearly half of men will experience symptoms of BPH, and that number increases with every passing decade. Even if you feel fine now, being over 40 means it's time to start paying attention to your prostate health. Those with a family history of prostate problems, if your father, brother, or another close male relative has had prostate cancer or other prostate issues, your risk is significantly higher. Genetics play a major role, and men with a family history should be especially vigilant about early screening and lifestyle choices. Men with a sedentary lifestyle, spending most of your day sitting with little to no physical activity, can lead to poor circulation, hormone imbalances, and increased inflammation, all of which affect the prostate. Regular movement doesn't just help your heart and weight, it directly benefits prostate function as well. Diets high in processed foods or red meat. Consistently eating fast food, fried foods, red meat, and high-fat dairy may raise inflammation levels in the body and contribute to prostate problems. Studies have shown that diets low in vegetables and high in saturated fats are linked to higher rates of prostate cancer. Chronic stress or poor sleep habits, ongoing stress and lack of sleep can disrupt hormone levels, weaken your immune system, and increase inflammation, all of which can negatively impact your prostate. Sleep is when your body repairs and balances itself. Skimping on rest puts unnecessary strain on all your systems, including your reproductive health. These factors don't guarantee that you'll develop prostate issues, but they do make it more likely. The good news? Many of these risks are modifiable. Recognizing them early gives you the power to make proactive choices that protect your health over time. Knowledge is power, and in this case, it could protect your future. What you can do to protect your prostate. The good news is that while some risk factors, like age and genetics, can't be changed, there's a lot you can do to support your prostate naturally and reduce your chances of developing serious issues. Below are simple, proven lifestyle changes that can have a real impact on your prostate health without needing drastic diets, supplements, or medications, unless advised by a doctor. Eat more cruciferous vegetables. Vegetables like broccoli, cauliflower, kale, cabbage, and Brussels sprouts are rich in compounds like sulforaphane, which may help reduce inflammation and fight abnormal cell growth in the prostate. Aim to get these into your meals a few times a week. Raw or lightly cooked is best for preserving nutrients. Add healthy fats. Nuts and seeds like walnuts, pumpkin seeds, flax seeds, and chia seeds are high in omega-3 fatty acids and zinc, both of which are essential for prostate function. These healthy fats help lower inflammation and support hormone balance. A handful of mixed seeds or a tablespoon of flaxseed in your smoothie or oatmeal can make a big difference over time. Limit red meat and high-fat dairy diets, high in saturated fats, especially from processed or grilled red meat and full-fat dairy, have been linked to an increased risk of prostate problems. While you don't have to go completely plant-based, cutting back on processed meats like bacon, sausage, and deli meats can lower your risk. Try replacing some meat meals with fish, legumes, or plant-based proteins. Stay physically active. Regular movement isn't just for your waistline. It's one of the best ways to support prostate health. Physical activity improves circulation, reduces inflammation, helps regulate hormone levels, and supports a healthy immune system. You don't need to run marathons. Just 30 minutes of walking, stretching, or light exercise most days of the week can have a powerful effect. Drink more water, less caffeine and soda. Staying well hydrated helps flush out your urinary system and can reduce irritation. Meanwhile, excessive caffeine and sugary sodas can irritate the bladder and prostate, especially if you already experience urinary symptoms. Aim to drink at least 6-8 glasses of water a day, and be mindful of how caffeine affects your urination patterns. Get regular checkups. Even if you feel healthy, regular prostate screenings are one of the best tools for prevention. Men over 50, or earlier if you have risk factors, should talk to their doctor about prostate-specific antigen (PSA) testing and digital rectal exams. Early detection is key, especially for conditions like prostate cancer that can grow without obvious symptoms. In summary, protecting your prostate isn't about extreme measures. It's about consistent, healthy habits. Small changes in your diet, movement, hydration, and medical check-ins can lead to major improvements in your overall prostate health and peace of mind. Your future self will thank you for starting today.